So are you looking for a solution to simplify shade selection? I'm sure you are. Accord is designed to cover 90% of all clinical situations. 5 core shades, A1, A2, A3, A3, and A4. A1 covers the classic Vita, A1, B1, and D2. A2 covers A2, B2, C1, and D3. Now, good point here being as far as savings and not stocking as much composite when you're buying kits. How often do you pull out the D2s and the C1s and the D4s? Not very often, but you use A2 and A1 a lot, right? So here's a material that can be used to cover even those shades that you don't use so much, so that you don't have a bunch of composite going out of expiration. The A3s cover A3, B3, C2, C3, D4. The A3-5, the dark lower values, A3-5, B4, C4, and A4 is its own animal. So here we are looking at the Vita Shade Guide. And Accord A1 covers those 3 shades, A2 covers those 4, A3 covers those 5, as I mentioned, A3-5, and then A4. Now, what you probably don't notice looking at these slides is there's been a circular preparation done in the middle of each one of those shade tabs, and the corresponding core shade of Accord has been placed. So over here in the A1, for example, there's an A1, there's a preparation placed in there with A1 Accord. There's a preparation placed in there with A1 Accord. There's a preparation placed in there with D2 Accord, and so on and so on and so on. So you see how nicely things blend. Here's one of my clinical cases. Now, I had too many clinical cases yet because this material is that new. But I had a patient that had a composite, as you see. I took out the composite. Don't know how she got that type of vertical lesion, but using the A2 Accord, here's the restoration. Now you can see there's varying shades throughout that tooth, but the A2 Accord disappears in the entire cervical incisal length preparation. Here's the class 4, where we've beveled. Now, when I do class 4s, I always bevel 2 to 3 millimeters, and I go from the mesiofacial line angle to the distal facial line angle so that we don't have a vertical line or a diagonal line across the middle of the front tooth. In this case, I did total etch, rinsed, etched for 15 seconds, rinsed, dried, placed G Premio Bond, air thin and light cured, and placed just a real little thin layer of universal injectable. Because again, going to the first series, I always like to have that intimate layer of flowable material between the remaining composite and the existing tooth structure. So we have a nice uniform coverage of the preparation. You'll have a oxygen inhibited layer there that'll be a little bit sticky, so it'll be easier to add subsequent layers. So here I'm blending with the brush, a layer of Accord, and then placing a mylar strip and my index palatal, my index finger, well actually that's my dental assistant, she's got pink gloves, I got blue gloves. She's holding that mylar strip there as a palatal matrix. There's my gloved hand there, pulling the mesial part of that matrix through and across the facial surface of the adjacent tooth while I'm blending the Accord across the preparation with a little tool made by Curcavo. It's called a compo roller. Now I'm going to get a little bit fancy with this one because you can see all of the whitish subsurface staining in her teeth. So I place a little bit of irregularity with an EP 3 extra fine, placing a little bit of vertical indentations where the lobes would be. The lobes of the anterior tooth, there's a mesial, a central, and a distal. And then a little white composite tint. After curing that, place my final layer of accord, blend it with the brush, light cure, and then finishing. Finishing is with an ET number 9 and sandpaper discs, diamond strips, and polishing brushes. So here's our finished restoration. Remember, it's a class 4 mesial, but you can't see the diagonal finish line. The accord material blends in beautifully, covering the slight variation in shades. So it eliminates getting real fancy and having to do multiple shades to create that effect. Here again is our finished restoration, where we started, where we finish.